Okay, so good morning everyone. Today we will start our reporting session. Case interpretation session. Step 1. Okay, this is a 14-year-old female patient presented with hand swelling, long standing. Okay? So X-ray was done. What's going on here? Describe. What do you see? طبعا اكو two views.
X-ray of the hand and forearm.
Okay.
Lower forearm.
Okay.
AP and
Distal
lateral.
forearm ما يقولوا lower.
Distal, yes. Distal forearm.
Mhm.
AP and lateral.
Well, it's oblique, not lateral.
Yes.
This is oblique.
Yes, it's oblique.
Showing. خلينا على AP. Oh, sorry. Showing what?
Soft tissue swelling.
Okay.
Of
Soft tissue swelling of the what?
the thumb
And the
radial aspect of the palm
okay.
with multiple
Multiple calcified
history, yes.
swelling.
Yes.
Hand swelling. Long standing.
With multiple calcific spots
Multiple calcific spots.
of different size.
What's the unique feature of these calcific spots? Describe the calcific spots. What do they look like? They're rounded. They are rounded.
Yes, rounded.
They have central lucency. If you look carefully,
Yes, yes.
there is
Yes,
central lucency, like here, lucency here.
yes. And
Okay.
Echogenic rim.
No echogenic in X-ray. You say hyperdense
Yes,
or
yes,
dense.
Yes, yes.
You don't say echogenic in. This is an ultrasound.
Yes.
اوكي لازم شغل الترا ساوند زين يلكم هالايام بحيث ايكوجينيك صاير ماخذ لسانك عليه زين ايه
والله ما داوم.
المهم so what are these calcific spots called شو يسموها هاي لها اسم calcified شنو عمر تعرف phleboliths exactly these are called calcified phleboliths زين calcified phleboliths اللي هي شنو calcified phleboliths do you know
Yes, inside the vein.
it's a vein calcified
Yes.
okay so calcified phleboliths with soft tissue swelling in the hand mainly in the thumb in the radial aspect of the palm it's long standing
And forearm.
even forearm yes I'm just zooming يعني إذا ناخذ هي even the distal forearm in fact all the forearm is calcified. It contains calcified phleboliths. Okay. So, what is the case? What is the diagnosis here? Spot. One diagnosis. No DDX. شنو يطلع بيه calcified phleboliths with soft tissue swelling?
In
Or-
diabetic patient, there will be.
She's 14 years old. She's not diabetic. These are calcified arteries, not calcified veins. Diabetic. So, Amar, hemangioma. Soft tissue hemangioma is typical or characterized by soft tissue swelling that is infiltrative. It starts somewhere, like maybe starting here and then extending up and involving the hand, and it's typically characterized by multiple multiple calcified phleboliths. Okay, in the MRI you will see the infiltrative nature of this mass. It goes everywhere between the bones, between the joints, and it's enhancing, of course, it will be enhancing because it's a hemangioma. Okay,
Right on.
so يا syndrome ب هذه أول syndrome هي شنو هي؟ المافوشي اللي هي شنو هي مافوشي syndrome؟ multiple enchondromas with hemangioma. This is maffucci syndrome. طبعا we don't have enchondroma here. What else?
Multiple hemangiomatosis.
Multiple hemangiomatosis. Okay. We have multiple hemangiomas, multiple parts of the body. Okay.
Clinical
McEwen-Albright syndrome. McEwen-Albright.
this is polycystic, polystotic fibrous dysplasia
With precocious puberty.
Endocrine. I don't think there's hemangioma in that.
McEwen-Albright ما بيها hemangioma. Just
No,
أنا
no.
احتمال أنا متوهم. I don't know. I have to look that up. Okay.
I think the clinical هذا شو اسمه هذا الاتروفي يصير.
لا التروناني هذه مو قصدك التروناني يصير هايبوبليجيا او هاي يعني تلاقي البون ميسنج
ما يصير hemangioma.
ما اظن ما I'm not sure but ما اظن اوكي
والله بيشو رانيني بس الفاسكولار الكلاسيفيكيشن بيها
اوكي
soft
we
هم
need
ثلاث شغلات.
we need to look them up okay good thank you يلا احد صار ما دا اتذكر كم سنه ما شايفه يعني كم سنه ها وين كنتي شنو ها تركيا دخل شوف الاتراك ايش حال موت تعال هاي رادلها ثقيل زين اوكي نعطيك فد كيس للعزيز بس سبوت شوفي this case literally it's a case report يعني no one including me even guessed it ولا حتى اجت ببالي okay so يعني don't feel bad if you يعني بس pathologically we were all surprised يعني what the hell is that okay it's biopsy proven this is a 32 years old female patient presented with lower abdominal pain and things like that okay الماس يمج سوقي and tell me what do you see while you see it. Aryan, talk. This is an axial T2 weighted image of the pelvis. هذا T2. Okay. شوية بس صوت أكثر أعلى شوية ده. Of the pelvis showing so there is a T2 hyperintense mass large
which is extending in the level of rectum.
extending what?
At the level of the rectum.
Rectum. Okay.
Abutting both ear bones.
Where is the mass?
It's an infiltrative mass.
Just Aryan دقيقة. Where is the mass? Show me the mass. Okay, so all of this is a mass
Yes.
at the level of the rectum.
At the level of rectum and inferiorly transversely abutting both iliac bones.
Okay.
Extending upward.
You can see other sequences.
Total of bladder.
Okay.
And encasing the pelvic organ, uterus, ovaries, not causing pressure of the pressure.
Okay.
Don't have a pressure effect. So
21.
شوف لنا other sequences خلينا نشوف شلونها.
T1.
This is
T1 origin.
whatever. We'll see everything. This is T2, I think.
T1 normal, T1 fat cell.
Yeah.
We have normal T1?
I think. Look for it.
Fat
Oh, they are fat cells.
In fact, to be honest, this I just saved the images. It was not done by me. So this is post contrast, of course. This is T1 post contrast.
T2 post
Just
contrast.
wait, Ariane, leave the mouse. Just a second. T2, T1. Put a mark at T1.
T1 fat cell.
Okay. Why though they didn't do T1, which is weird. Anyway, this is T1 fat sat. Let's do both. The pre-contrast and this is T1 fat sat post-contrast. Let's see.
The mass is hypo in T1
Oh.
fat cell.
Okay.
And it's mostly fatty. Also, we don't have normal T1 to be
Sure.
separate.
Exactly.
But also fat can't be high in
Well, let me help you with that. It's not fatty. It's more of a fluid.
fluid. Okay.
Okay.
Ugly.
Bubbly, exactly. Multicystic fluid.
So it's hypo in T1 fat cell.
Okay.
And then there is mild peripheral enhancement of the mass
In the septi, let's say.
in the septa of the mass.
Okay.
Multilocated septa or
Tamam.
bubbly appearance
Nice.
or honeycomb appearance also we can say that.
Good. You can say that.
Yes.
So, first of all, let's start شلون نقول step by step. What does it look like to you? Like what would you say in the differential diagnosis part?
Mass in T2 is hyper.
So, it's
In T1 we don't know.
hyper, hypo. I'm telling you, it's hypo on
It's
T1.
hypo, okay.
Okay. It's showing
It's a
wall post-contrast enhancement.
contrast, septa and wall.
It's infiltrative.
Yes, infiltrative, encasing,
It's encasing everything
not compressing.
but not compressing without mass effect. Okay.
No, it's benign behavior, not
It's in a young female, 32. Okay. So, is it benign or malignant? This is the question.
benign. Seems benign.
It seems benign,
Yes.
although it's
It's
infiltrative.
also it's infiltrative, also it's a large mass. I don't know the duration.
It's
If
been
not
there for a
long
while.
duration, it's benign.
It's benign. Okay. Like what? Good.
Lymphangioma.
Lymphangioma. It's one of the possible differential diagnoses. Yes. Good. What else? Hydatid. Well, hydatid usually cause mass effect. It's not. It does not cause mass effect. First and
It's
second,
not single, it's multiple, each of them.
and
Or previously you have a large big hydatid
and
structure.
second, hydatid is not infiltrative.
Yes.
It's a space. It does not extend between things. Well, okay, we can put multiple hydatid.
Till now, we don't know the origin of the mass. Can we see something surgical?
Good note. Very nice.
The origin.
In fact, the answer is in the origin. Well, although it's a very rare thing, but very rare entity. But try.
ما كان بيقولها fat.
لا لا.
يعني if there is small amount of fat, we can put myxoid like sarcoma.
Myxoid liposarcoma is if it was fat, if it contains
Small,
fat.
even small amount.
Yeah, I agree. But there was not. Take it from me. I don't know why they didn't do T1. I have no idea. Wallah. Can you determine the origin?
That's from the wall of the abdomen.
It's if you find more than one space.
Sorry?
Behind more than one space. Retro,
Okay.
uterus, uterus. I think lymphatic malformation.
It's a top in the differential, one of the top differential diagnoses. Okay.
She has any previous history of surgery?
No. The only surgery that she did to remove this mass and have the pathology, the histopathology result.
not invading any structure.
This region, is it, the origin is in the bone?
No.
Infiltrated to the soft tissue?
Does the bone look like the origin to you?
No.
It's a normal bone.
I am asking.
E-
From the iliac region, from the SI joint region?
Okay, but is there any abnormality in the bone to suggest that it's bony origin?
No, I cannot see it from the.
This is first. Second, just one by one. Even if it is from the bone, what would you put as a differential? Let's assume يعني it's from the bone.
Hypocystic lesions.
ايه شو تحطين يعني؟
Osteal.
اوستيوساركوما؟
لا.
ها
يعني البوسس هيجي
ما عندنا شيء من البون يفوت على السوفت شيء.
يعني كشكل خارجي.
No, it's not from the bone, definitely. Okay, Sarah?
From the pelvic floor يعني
Pelvic floor يعني you mean muscle?
يعني
شو تقولون يا شباب؟
some of them يعني looks cyst not just like this one.
Okay.
Multiple cystic.
So
Could be something nice from the peritoneum.
we are confused about the origin. Okay?
From the peritoneum.
طبعا one of you said the origin correctly بس ما راح اقول لكم منه بعدين. زين. هسه قلنا الانفنجيوما توب ديفرنشيال وقلنا maybe hydatid ولو unlikely يعني it does not look like hydatid.
It's look like congenital.
No, it's not. It's acquired.
This one acquired.
Yeah.
Rupture appendix. and-
Rupture appendix. She's very stable. She come walking
يعني
and
using as a-
مو liposuction.
لا ولا ماكو previous surgery ماكو. Sorry? Urachus. Like what? يعني كدف. Okay, let's assume. شو يكون الديفرنشيال دايجنوستس بالحالة أو شو تحطيني؟
الفلويد نيتشر مالته ما
زين. طبعا
By ultrasound شلون كان؟
multi cystic lesion. Not vascular يعني.
دكتور هاي
Could be
hyperstimulated
ovarian
ovary.
tumor.
It is يعني one of the possible differential diagnosis of ovarian hyperstimulation syndrome. However, she has no history of use of يعني induction. Ovarian tumor is a very high possibility to have an ovarian tumor like serous or mucinous cystadenoma or things like that. Yes. بس إلى حد الآن we are not even close to the histopathology. We are not even close.
Previous flu.
Well, it's peritoneal in origin.
Yes, I say peritoneum.
She said peritoneal.
I don't know. I didn't know. But
Okay.
I said something arising from the peritoneum.
Good. It's peritoneal in origin. It's benign. يلا هاي اعطيتكم two clues.
Benign from the peritoneum.
This almost surprisingly, it's a very rare thing that's called benign multicystic peritoneal mesothelioma.
Yes, I think benign what that is.
I mean, يعني
Biopsy prove it.
it's removed by surgery and follow-up is no recurrence there and she's good and everything is doing
Yes,
benign multicystic peritoneal mesothelioma.
Mesothelioma come to my mind, but I say.
I mean, who would think of mesothelioma in the pelvis? يعني it's ظاهر
دائما يسوي لنا peritoneal masses نفسس. اليوم
هي.
هيك peritoneal thickening
a rare variant is multicystic mesothelioma. It's a benign.
دكتور هاي مال بريتونيوم ما يجي من البيلفيك شوية أكثر من يعني
هو يسموها شوفي يسموها هي مرات يسموها benign multicystic peritoneal mesothelioma أو mesenteric mesothelioma أو حتى omental mesothelioma حسب from where.
بالضبط يروحوا ويا lymphatic malformation. يعني
By all means, anyone would report as a lymphangioma or lymphatic malformation or things like that. It's and you are totally correct or on the right side to write that, and no one can blame anyone to say anything else. Okay, so it's a very rare case that I would like to share it with you. Okay, and عندنا بعد وقت لو خلاص لا عندنا مجال يلا خلينا نشوف منو هاي شنو نشوف. اوكي تريدين بعد واحدة؟ ما عندي مشكلة. ست. يلا an easy one. 2 3. Good. This one is easy ماكو يعني straight forward. بس خليني اشوف اتأكد. اوكي منو عندنا؟ غير الوجوه الصاعدة يعني شلون نقول المواهب This is an 18-year-old female patient presented with leg pain, sorry. يعني not severe, just Okay, so سارة أنتي ماستر مو؟ Good. يلا. First of all, okay, let me help you with the MRI images. What do we have here? Let's go with this. This is a sagittal T2 fat saturated image of the what? Which part of the body is that? ايد رجل تمام. Of the upper شنو leg. Let's make it bright a little bit. Okay, T2 fat saturated image sagittal of the upper leg. I don't know, left or right maybe, who cares. So showing, what do you see? Just describe what do you see. That's it.
Hyperintense lesion.
T2 hyperintense lesion.
Somewhat heterogeneous.
Where is it located?
It is located metaphysis of the tibia.
Metaphysis of the tibia.
Yeah.
Extending to
Extending to the
well diametaphysis. حتى
metaphysis.
okay.
Yeah, but there's
Extending
something
to where?
on the posterior portion.
هسه نجي لوحده. خلينا بالليجن اصلي. Start with the original lesion. Extending to where?
Intra-articular.
To the articular surface of the tibia. Okay? So it's from the diametaphyseal region, proximal diametaphyseal region, extending to the articular surface. Okay. Associated with what? Let's see another something. Okay, let's see another sequence. This is survey. Sorry, just give me 1 second. Let's see what's this. This is just normal T2 without fat saturation. Okay, how does it look like here?
It is heterogeneous.
Heterogeneous. Hypo or hyperintense?
Hypo. It is predominantly hypo, but it is mixed.
Containing area of hyperintensity. Okay.
Central hyper.
Is it causing bone destruction or not?
No.
Just wait before. Let me show you something might help. Let's see this. This is what? This is axial T2 fat saturated. Is there bone destruction or not?
Yes, yes.
Where is it? أشري لي الماوس يمك أشري لي. Where is the destruction?
My line
Excellent job. You see the cortex here? It's intact. While here it is gone. It is destructed.
because it's extending to the muscle.
So it is associated with extraosseous component. هاي extraosseous component, how we describe it? It's a soft tissue mass. Soft tissue mass, right? Extending from the tibia and becoming in contact with what? With the fibula. However, no signs of invasion of the fibula. The fibula looks quite good. Okay? So, let's see, do we have something else interesting? Let's see the contrast, post-contrast. This is T1, post-contrast. What does it look like, the mass? Enhancing or not? The lesion. this is T1 post contrast fat saturation طبعا. Is enhancing or not؟ يعني just a second, wait. Let me make it your life easier. هسه هذا T1 before fat sat without contrast, without fat saturation, and this is with fat saturation. The mass enhancing or not? It is markedly enhancing, and if you look carefully, it's encasing the proximal fibula. Okay,
حتى الفصل نشوف الفصل
and
زينة شوية.
زين. What's your differential diagnosis for a female with 18 years old presented with dull leg pain and MRI shows an intraosseous mass of the tibia with soft tissue component and possible encasement of the adjacent fibula. لاحظوا انه الكيس يعني على قد كل واحد على قد الليفل مالته فيعني لا تطلعون عضلاتكم. ها شو تحطين؟ وحده عمرها 18 سنه جايه بماس بالبون، شو تحطين؟
يعني it is a aggressive lesion لازم
aggressive.
يعني
من نقول aggressive واحد من اثنين، شنو مال aggressive؟ two lesions او two types of lesions.
osteochondral
يا infectious يعني osteomyelitis يا malignant، هذول الاثنين بس اللي هم نقول عليهم aggressive. زين. Does this look like infectious or inflammatory يعني osteomyelitis؟
الاوستيومايلايتس عادة من الدايابيتس
اوكي but بعد كملي.
يعني لا ما يشبه هذا الانفكشن.
ليش؟ ايش تتوقعين اذا لو كانت osteomyelitis what difference does it make؟
يعني هذا يصير عنده يعني الشيب يفرق يعني من الدايابيتس.
سارة we are clinicians.
لازم history.
We are clinicians. Number one. We are not photographers. Okay?
ماكو history of fever
لا fever. لا tiredness, fatigue, rigor, هالسوالف. No pain. Like pain. I told you dull pain. أكدت. Okay? No sign, no history of fistula formation or skin discharge. No previous surgery مثلا حتى نقول صاير post surgical. Okay? No trauma. كل هاي ما عندنا. هاي واحدة. اثنين. It should present with collection, intraosseous, possibly extraosseous, with possible extension to the skin. Okay? هاي كلها ما عندنا. So definitely this is not osteomyelitis. الأوبشن الثاني شنو؟ تيومر. حلو. aggressive قلنا. ب 18 سنة بالتيبيا with soft tissue mass شو يطلع؟
إذا صار مجاوب خلي جماعة الماجستير يجاوبون.
هو هسه خلي يعني شو نقول احنا على كل من كل قطرة أغنية. شو يكون؟ واحدة عمرها 18 سنة جاية بون ماس شو يكون؟ اكو غيرها؟ It's definitely 100% it's osteosarcoma until proven otherwise. Okay? زين. Less likely than osteosarcoma شو يكون؟ أو خلينا نقول مو less likely. The second differential after osteosarcoma شو يكون؟ ب 18 سنة bone mass with soft tissue component. ها؟ هم اثنين ماكو غيرهم. عافية. انت ايش قد؟ third fourth ايش قد هو؟ عافية. good job. Ewing. زين. Ewing's sarcoma. ليش ما نقول Ewing's number 1 على هاي؟
ما عندنا هذا الأونيون بيل.
الأونيون بيل هذا نشوفه وين؟ بالاكس راي.
لازم يكون عندنا اكس راي.
زين؟ احنا طبعا دائما نقول لكم انه من تجيك بون MRI اول شيء تسال وين الاكس راي؟ اقول لك I will tell you I don't have an X-ray but you have to ask. You must ask. If you don't ask you lose marks. اي بون CT او MRI or whatever anything related to bone اول شيء قبل لا تقول this is an MRI نقول what is the X-ray؟ اقول لك ما عندي اوكي you get these points, you didn't lose points. اوكي نشوف
يعني اكس راي كلش تفيد هذا.
زين ليش يعني انه الايج is not in favor of Ewing. it's 18 يعني little bit older,
large soft tissue.
and this is the key
large soft tissue.
finding. Ewings always present with a huge soft tissue compound, like huge. اوكي لا هذولاك الاوستيو. اوكي دي مالها كل علاقه الموضوع. Whenever you see a big, like really big soft tissue mass related to a bone,
That's two possibilities.
اول شيء تحط تقول هاي Ewing.
Second lymphoma.
However, Ewing is much more common than bone lymphoma. يعني كم bone lymphoma شايفين احنا؟ It's like كم واحد
خارج القطب.
وبس. زين بينما كم Ewing شايفين؟
الايج هم يعني
هو ده قلنا اول شيء الايج از شويه ادفانسد اكثر من انه يكون Ewing. على الليمفوما اذا تحكي له على Ewing.
حتى الليمفوما الايج يكون مور ادفانس.
اوكي ف اني بون اذا شفتوا بون سوفت تيشو ليجن بيج سراوندينج ا بون اوكي او في الايج او في البرزنتيشن او في كل شيء كلها تركها على صفحه اكتب Ewing وعلى ايه.
ودايفيسس الاوينج اكثر شيء.
ممكن تجي دايفس تجي بفلات بونز.
دايفيسس.
اوكي اي وتجي بفلات بونز همينه بالالياك وينج بالسكابيولا بالها حتى يعني تجي بعده اماكن بس الكاركترستيك بارت از هيوج سوفت تيشو ماس هيوج هالكبر. زين هذه Ewing اكتبها واذا طلعت غلط هم ما حد يحكي وياك. يو ار توتالي كوركت. هو يعني once let's finish here first.